difficult to recognize hypoglycemia, which is usually defined as blood glucose below 4 millimoles per litre. Not all patients will have symptoms. Hypoglycemia is a concern in hospitalized patients as it is a marker of poorer outcomes, including increased mortality. George is 60 years old, with 6 children and 4 grandchildren, who was admitted to the intensive care unit for management of a closed head injury after being found unconscious by his wife in their vegetable garden. In view of reduced consciousness and unsafe swallowing, enteral feeding was started. As he has type 2 diabetes and is normally on insulin, insulin was continued throughout enteral feeding. He required protophane, 40-unit Marne, and 20-unit Nocte to control blood glucose levels while receiving enteral feeds from 0-800 to 2000 hours. Blood glucose levels have been 6 to 9 millimoles over the last 24 hours. After regaining consciousness, he was transferred to a medical ward. Enteral feeding was discontinued at 1300 hours when he was found to be able to swallow safely. 3 hours later, George's nurse, Tom, notices that his patient is pale, sweaty, and irritable. Treating hypos, no decreased loss of consciousness. He knows these are possible signs of a hypo, so he checks George's blood glucose level, which is 3.3 millimoles per litre. Tom's first step in managing the hypo is to decide if the patient has a decreased level of consciousness. This isn't the case, so he assesses if it's safe to treat George orally. Since George's enteral feeding was stopped 2 days ago and he can swallow safely, Tom gives the patient 15 grams of liquid carbohydrate from the local hypoglycemia kit. He will test the glucose level 15 minutes later. If George's BGL is above 4 millimoles per litre, he will be given a long-acting carbohydrate, such as a biscuit, slice of bread, or his meal if it's due. However, if George's blood glucose level is still below 4 millimoles per litre, Tom will repeat the process of giving quick-acting oral carbohydrates and repeat the treatment. If George fails to respond, then Tom should call for a clinical review as per the yellow zone between the flags clinical response. Once George's glucose level is 4 millimoles per litre or higher, the team can then focus on addressing the cause of the hypo to prevent further episodes occurring. In this case, George's hypoglycemia may have been caused by stopping the enteral feed without adjusting the protophane. George will need rechecking in 2 hours to ensure his blood glucose levels are remaining above 4 millimoles per litre. He may need some increased monitoring for the next 24 hours, such as QID and overnight. If George is hypoglycemic and conscious but is still being given nasogastric tube feeding, what happens then? Let's find out what would have happened. Treating hypos with decreased level of consciousness. Due to aspiration risks, Tom alerts the junior medical officer, Rani, who will administer subcutaneous glucagon, intramuscular glucagon, or intravenous glucose depending upon the situation. Some New South Wales public hospitals may have local policies around nurse-initiated subcutaneous glucagon. Always refer to local policies. If George has an impaired conscious state, then it isn't safe to use the oral route, and Rani, along with attending to his airways, breathing and circulation, needs to give George intravenous glucose. She administers an IV bolus of 50% glucose, 25 to 50 millilitres, and the blood glucose is retested in 15 minutes. If the glucose level is still below 4 millimoles per litre, then that process is repeated. So, George receives a further bolus of intravenous 50% glucose. Once blood glucose level is at 4 millimoles per litre or higher, Tom and Rani can begin investigating what caused the hypoglycemia to prevent further episodes. Additionally, if the blood glucose level is 4 millimoles per litre or higher, but there is still impaired consciousness, then look for other causes. Once the blood glucose level is at or above 4 millimoles per litre, Rani follows up with IV treatment. Tom will recheck the blood glucose levels every hour until they are stable. In summary, hypoglycemia occurs when the patient's blood glucose level is below 4 millimoles per litre. Symptoms may or may not be present. A blood glucose level under 4 millimoles per litre needs to be treated and escalated through the clinical emergency response system between the flags when required. Use oral glucose, subcutaneous glucagon, or intravenous glucose if the oral route is not safe or available. Once the blood glucose level is 4 millimoles per litre or higher, recheck the blood glucose in 1 hour to ensure that hypoglycemia has not recurred. It's important to review the cause of hypoglycemia to prevent further episodes, and prevention will depend upon the cause. The prior dose of insulin, not the current dose that's due, is usually the issue. The next dose of insulin should not be omitted, but it may need adjustment.